Welcome everyone to our Prezi. My name is Asia,
I'm Brenna.
and we're doing our presentation on multiple sclerosis. So multiple sclerosis is a chronic disease that's typically progressive, involving damage to the nerve cells in the brain and spinal cord, or just to the central nervous system in general. What causes multiple sclerosis? Doctors actually aren't completely sure what the causes are, but there is some interesting data that suggests that it has to do with genetics, so it comes from your family, or a person's environment. Also, there are triggers that can trigger MS if you're predisposed to getting MS, and then possibly there's a virus that could play a role in it as well. Who gets MS? It's twice as common for women to get MS than men, and also Caucasians are most at risk compared to any other race. And it develops highest between the ages of 20 and 50 years old. So we just want to share this video about what kind of happens to your nervous system when you have MS.
Multiple sclerosis, MS, is a disease that affects the central nervous system, the CNS, which consists of the brain, spinal cord, and optic nerves. Everything we do, whether it's taking a step, solving a problem, or simply breathing, relies on the proper functioning of the CNS. To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of nerve cells called neurons continually send and receive signals. Each signal is a minute but necessary part of intricate CNS orchestrations that culminate in the actions, sensations, thoughts, and emotions that comprise the human experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and viruses. But in MS, something goes awry. Immune cells infiltrate the brain and spinal cord, seek out the myelin, and attack. As ongoing inflammation and tissue damage occurs, nerve signals are disrupted. This causes unpredictable symptoms that can range from numbness or tingling to blindness and paralysis. These losses may be temporary or permanent.
Okay, so now we're going to talk a little bit about the symptoms of MS. So these symptoms always vary based on the portion of the nervous system that's affected with the lesions. So there's initial signs of MS. So during early stages, they typically double vision is present, unusual weakness, fatigue, or numbness. And then as the progression goes on, things like slurred speech becomes present, gait becomes stiff or staggered, so you've got like shuffling of feet, tremors, spasticity, paralysis, and all the other things in that huge list can be present. And not all of them are always present, it just varies from person to person. So this is a little image that shows what parts or what symptoms affect the body, so you can kind of look at that. And then primary and secondary fatigue is a big part of the symptoms. So primary is related directly to the disease process, and then secondary would be caused by other disease-related factors such as weakness and deconditioning. Okay, and then there's a couple terms you need to understand. So relapse is an experience worsening of the symptoms, additional symptoms, or both. And then remission is when the symptoms of the relapse can improve but are still there, or they can just disappear completely and they'll be back to where they were before the relapse. And then there's things called symptom triggers. So these can be stress, fatigue, and heat. Especially heat. Hot temperatures and physical exertion often increase your symptoms and make them even worse than they were before. But usually, as soon as you get rid of these triggers, the symptoms are reversible.
So how does a TR help in a process in a client who has multiple sclerosis? Some of the things that I found were they help them find recreational activities that they can participate in, because a lot of times people will be diagnosed later on in life and all of a sudden their whole life has changed. And so you would go in and help them find other things they can enjoy doing that because they may not be able to do some of the activities that they're used to being able to do. We also help them stay involved, and it's really important that they continue to stay social and interactive with other people, because a lot of times people who have multiple sclerosis also get depressed, and so to help them can maintain those social interactions with other people. We also help them strengthen their muscles and continue to have function in their bodies through recreational activities. And like Brenna was saying, we need to be careful when we're doing this, because the intensity and the temperature duration can trigger their multiple sclerosis to get worse. So we have to be aware of that as we're working with these people. There's a lot of delivery settings that you can use with working with people with multiple sclerosis. Some of them are hospitals, which is in really extreme circumstances. And then they also have medication that they can take to help relieve the pain and stop muscle spasms and things like that. And then there's rehabilitation centers, residential and community programs, and also in-home health care that we can use.
Okay, some intervention considerations. So when planning TR plans, you need to make sure you take heat tolerance into consideration. You want to avoid heat and humidity. You also want to choose activities that treat the MS symptoms and help reduce those or make the person more comfortable. Stretching exercises promote relaxation and prevent contractures. Like Asia said, again, exercise levels have to be monitored to avoid fatigue and overheating. That's super, super important with MS. It's important to understand side effects of the medications that the client is on to treat their MS. These can interfere with their performance in the activities that you are planning. Continuous movements are easier for those with muscle spasticity, which was one of those symptoms mentioned earlier. And those are our sources.
Thanks, everyone. Have a
Thank
good day.
you.